Introducing our speaker tonight for our Cleveland Clinic PM&R Grand Rounds on January 15th, 2024. To everyone, happy New Year. We hope you had a restful holiday season. I am so sorry. My puppy is in the background if you hear him whimpering. I apologize. Anyhow, this evening, Benjamin Burnham will be speaking to us on the function, bridging the worlds of CrossFit and Physiatry. Now, Dr. Burnham is one of our PGY4s, one of our senior residents, and actually one of our chief residents. And I just wanted to give a little introduction. He's actually local. He hails from here in Ohio. He completed his undergraduate degree at Franciscan University of Steubenville. Following that, he obtained his medical degree at the Ohio University College of Osteopathic Medicine, also intrastate. And while everyone was dealing with the COVID pandemic, sorry, it's my puppy, Dr. Burnham was busy getting his certification in CrossFit Part 1. So, without further ado, I wanted to introduce Dr. Burnham. And I find this interesting because CrossFit has definitely brought more business into my practice. So I'm excited to hear how bridging these two worlds comes together. But I could say clinically it does.
All right. Well, thank you, Dr. DePool. All right, let's get started. So I have no financial affiliations to disclose, but I do have to say that, like Dr. DePool said, I do CrossFit, and if you give a CrossFitter a platform, they're just going to talk about CrossFit. So bear with me for the next 45 minutes or so. So my first experience with CrossFit was when I was in college. My roommate first started doing it. I just wouldn't stop talking about it. So I told myself just by sheer principle I would not do this. But 4 years later, when I was in med school, stressed about taking board exams, trying to be more efficient with my time, I figured I'd give CrossFit a try. Started going to the gym and having to wait around for a lifting platform or a machine to open up, and also didn't have the time to try to come up with my own programming. So I knew CrossFit would give me a good 60-minute workout with structured programming. The equipment would be ready to go, and the coach would tell me exactly what to do, and all I had to do was show up. And they take care of the rest. That's the worst that could happen, right? Well, I started seeing, a lot of the similarities between CrossFit and PM&R, so much so that, I took the effort. I went and got my CrossFit Level 1 certificate, and I started coaching some classes in my free time during med school. And then I also went and I took the Adaptive Training Academy certificate to be able to coach adaptive athletes. So I slowly started putting these ideas together in my head, and this is now what I've put together for this Grand Rounds presentation. So what is CrossFit? Well, it's a branded fitness regime that was founded by Greg Glassman in 2000. He was a former gymnast that revolutionized the fitness industry with his inception of this exercise philosophy. Initially, it started with the gym in Santa Cruz, California, and he'd post the WODs or workout of the day on an online platform for free. And people were able to perform these workouts and post the results on an online leaderboard so they could track how they were progressing over time. And eventually the company grew and other affiliated gyms began to open up. There's currently about 11,000 gyms throughout the world, and there's an estimated membership between 2 to 5 million. In addition to the local affiliate gyms, there's an annual competition called the CrossFit Games, where the top athletes compete to earn the title of fittest man or woman. But when someone says that they do CrossFit, what does that mean? It means they're in a strength and conditioning program that incorporates constantly varied functional movements performed at a high intensity. So why did he combine these three aspects into his fitness program? Well, CrossFit's sickness, wellness, fitness continuum is a conceptual framework that underscores the transformative journey from a state of potential sickness to optimal fitness with an intermediary stage of wellness. He combined the components of constantly varied functional movements performed at high intensity to move along this journey. So first, starting at sickness, this is your starting point where individuals might be susceptible to poor health and disease that acknowledges the consequences of a sedentary lifestyle or neglecting physical well-being. Wellness is the intermediary stage, um, highlighting the positive impact of engaging in CrossFit principles or, just general fitness. By embracing diverse functional movements at high intensity, these individuals enhance their wellness. And it's not merely the absence of sickness, but an active pursuit of overall health improvement. And finally, the ultimate goal is to attain a level of fitness that surpasses specialized athletic skills. CrossFit envisions fitness as a comprehensive state that contributes to a person's well-being on multiple levels. This level of fitness is likened to a super wellness, suggesting that it acts as a robust shield against diseases and serves as a foundation for navigating the challenges of daily life effectively. The continuum implies that CrossFit's approach to fitness is holistic, addressing various facets of physical well-being. It's not about excelling in one specific area, but about building a resilient foundation that safeguards against the impact of diseases and the aging process. So to create this level of super wellness, let's return to our definition of CrossFit and dive deeper into the different aspects. So the first aspect of this fitness program involves establishing competency in these 10 general physical 10 general physical skills. By training all these skills, you're able to have a broad skill set to prepare yourself for any task you may be faced with. The next aspect of keeping workouts constantly varied is by taxing all the main metabolic pathways. The three main pathways are the phosphagen, glycolytic, and oxidative pathways. The phosphagen pathways focus on high-powered activities and last for about 10 seconds, while the glycolytic pathways, primarily for moderate-powered activities, can last for a few minutes. And then finally, the oxidative pathway dominates low-powered activities and lasts for several minutes. Both the phosphagen and glycolytic pathways are anaerobic, while oxidative is aerobic. And both aerobic and anaerobic training are beneficial for improving cardiovascular function and decreasing body fat. However, when the focus is placed just on aerobic training, it can lead to decreases in muscle mass, strength, speed, and power, while anaerobic training leads to increases in those areas. So these efforts are commonly combined into interval training, where anaerobic training can be used for aerobic training while facilitating improvements in those other areas. But I'll get into that a little bit later on. So the next aspect that CrossFit focuses on is the utilization of functional movements. These movements involve the whole body and utilize universal motor recruitment patterns in multiple planes of movement. They're critical movement that allow us to remain independent throughout our life, as opposed to like a bicep curl. Looking at you, Logan. So a squat is just as simple as getting up from a chair or off of a toilet. A deadlift allows us to safely lift something up off the ground. Practicing shoulder presses are important to maintain our overhead strength. Training a burpee teaches us how to safely lower ourselves to the floor and pick ourselves back up. And then practicing step ups or box jumps is a great practice for using the stairs safely. I could give more examples, but I'm sure you get the point. And the final component is high intensity. And these exercises are defined as cardiorespiratory training at greater than 80% of your maximum heart rate, or in resistance training at greater than 70% of your 1 rep max. Studies have shown that increasing the intensity of exercise increases the training stimulus and adaptations like VO2 max, anaerobic threshold, stroke volume, and performance. By increasing the intensity of an activity, it leads to increased neuromuscular recruitment and firing rates, which improves neural connectivity. Through the increased intensity, you're able to have a similar, if not better, response than moderate or low intensity training in less time. And this has led to increased popularity in high intensity interval training. So when you combine these three components into a strength and conditioning program, it results in a program that looks to increase work capacity across broad time and modal domains. In CrossFit's theoretical hierarchy of development, it starts with nutrition at its base. If that is not a sound foundation, whatever you try to build on top of it will eventually fall apart. It then builds to improve cardiovascular sufficiency and metabolic conditioning. And this can be done through running, biking, skiing, rowing, or any combination of exercises that work to tax that system. The next is gymnastics, and at its core is the ability to control your body in space. After you can control your own body, then you're able to more efficiently control an external object. Through this model, you develop a level of fitness to be prepared for anything life may throw at you, because the goal is not to specialize just in one movement or modality or time domain. It's training for life. Now, one of the biggest critiques and concerns that you will hear is that CrossFit is dangerous. For a while, if you would try to Google CrossFit, you'd be inundated with headlines warning you about the dangers of CrossFit. And when talking with many people that have started CrossFit, many of them have said that many of their friends or even physicians warned them about the dangers of CrossFit and high injury rate. They felt like Ralphie just trying to get his Red Ryder BB gun, but getting shut down by his parents, teachers, and even Santa. But is CrossFit dangerous? So Fido published this study that was a review of injuries CrossFitters obtained in the previous 12 months, and he would send this survey out every year for about 4 years. And the definition of an injury within these studies is important to get a good sense of true injury rates. They defined injury as any muscle, tendon, bone, joint, or ligament injury sustained while doing CrossFit that resulted in consultation with physician or healthcare provider and caused you to stop or reduce your usual activity, typical participation in CrossFit, or cause you to have surgery. So they had about 3,000 participants complete the survey, and they found an annual incidence of 30.5% reporting an injury. The most frequently body regions are shoulders, back, knees, elbows, and wrists. And everyone likes to talk about risk of rhabdomyolysis. Within this, there were only 6 total cases, or 0.06%. So when looking at the injury rate, this is really important because this is how you're able to compare studies and compare different workout or different exercise programs. So when looking at the injury rate, they found the maximum number of workout hours per week resulted in an injury rate of 0.27 per 1,000 hours, and a minimum number of workout hours per week resulted in 0.74 per 1,000 hours. There's no statistically significant difference between sex, but when examining injury rates based on frequency of participation, they found a significantly higher rate of injuries in those that were training less than 3 days a week compared to those training greater than 3 days per week. And then when looking at injury rates based on length of CrossFit participation, they found that those with less than 6 months of experience had the highest rates of injuries. And then when comparing injury rates between CrossFit and other recreational exercises, really helps to put things into perspective. So there are many other articles that give varying rates for CrossFit, and they range anywhere from 0.27, as mentioned previously in that Fido article, all the way up to 18.9 in this Cizelli's article. But one important thing to note, again, is the definition of injury. For the Cizelli's article, they described an injury as any pain that required someone to take at least 1 day off from exercise. I don't know about you guys, but exercised my entire life, and there were many times after a day of training I wanted to take a day off from being sore. So that can lead to discrepancies within injury rates. When comparing these rates to other forms of similar exercises, you see similar to slightly higher rates of injury. These injury rates show that CrossFit itself is not inherently dangerous and should not be used to discourage someone that is looking to increase their fitness. So one common concern for people when looking to start CrossFit is that they may have seen an elite athlete on social media doing it, and they thought that this is something they never even be able to attempt because it isn't designed for them. However, this quote encapsulates the philosophy behind why people of all ability levels should engage in CrossFit. The essence lies in the recognition that while the goals and intensity may vary, the fundamental need for functional movement remains constant across different fitness levels. CrossFit, with its emphasis on functional movements that mimic real-life activities, addresses both the athlete and the elderly by promoting functional competence. For an Olympic athlete, the focus may be on achieving functional dominance or pushing the boundaries of performance. But in contrast, Nana and Papa are just seeking to functional competence to enhance their daily activities and maintain a healthy lifestyle. CrossFit adapts to individual needs, providing scalable workouts and emphasizing foundational movements that benefit everyone, regardless of their fitness level. This inclusive approach makes CrossFit versatile and effective fitness program for individuals with diverse goals and abilities. So now scaling can be done by adjusting the volume or intensity. But prior to that, it's critical to ensure sound mechanics within a movement. They have kind of this rule or philosophy: you just stick with the mechanics, consistency, and then intensity. So once mechanics are sound within a movement, the volume can be increased. And if you're consistently maintaining those proper mechanics, then you can move to try to increase the intensity of that core movement. And this rule goes a long way in helping to reduce injury rates. So to scale a workout, it can be done by adjusting the volume or intensity. This is typically done by reducing the load or speed. If that is not enough, the volume can be decreased by reducing the time, the reps or rounds that you do, or the prescribed distance. The idea is to maintain the intended stimulus by changing these factors, but not the programming itself. So this is just a different example. So SIMD is one of the named workouts. So RX is, whenever you have the prescribed workout, and then scaled or any modifications from it. So the typical RX Cindy or prescribed Cindy is a 20-minute AMRAP with 5 pull-ups, 10 push-ups, or 15 air squats. If you're not able to do that, you could try to scale it down to a 10-minute AMRAP or as many rounds as possible. You do 5 ring rows, 10 knee push-ups, or 15 air squats to a target, so potentially decreased depth. And then again, if even that is too daunting for you, you could drop it down to just doing 10 rounds for time. So you're still trying to maintain an intensity to finish within a good time. And instead of ring rows or pull-ups, you do 3 bar rows, 6 wall push-ups, or 9 air squats to a target. This is just one example. Even this workout, you could scale it, hundreds of others different ways. It all comes down to just the individual and what you're able to do. But not only is CrossFit infinitely scalable, it's also able to be adapted for people with various functional impairments. And obviously, as physiatrists, this is something very important within our world. Medicine has gotten to the point that many of the people that have previously died from the initial injury are now surviving, and physiatry has helped to aid them in their recovery and help prevent many complications that were previously fatal, like renal failure and spinal cord injury patients. Many of these patients are now faced with the same complication of the general population, which is primarily cardiovascular health. Ken and Kroll published an article that looked at barriers and facilitators to exercise participation in people with spinal cord injury. It's a pretty thought-provoking article with some great quotes from the study participants. And this is one that really stood out to me. Was this quote from a 45-year-old female that voiced her frustration with her physician not having any tangible recommendations for her to actually improve her fitness. It's understandable though, because there are not always that many readily available resources or accessible gyms for them. Within our field, the adaptive sports have become a great avenue to help this population engage in different physical activities and get more social activity. But when looking at CrossFit methodology and that hierarchy of development, this only touches the top of the pyramid without building from the foundation. Well, luckily, there are some very motivated individuals within the CrossFit community that have started the Adaptive Training Academy back in 2012. It's a group of adaptive athletes, therapists, and physicians that came together to overcome many of the barriers people with disabilities face within fitness. While they train many adaptive athletes, they're very active in educating people and training for the adaptive community. They host in-person training courses throughout the world, and they also have online seminars. Since 2012, they've had over 3,600 course graduates. They've trained over 1,500 gyms or organizations to be certified in it, and they're represented in more than 50 countries. So in 2019, during my 4th year of med school, like I'd said, I was able to attend one of these seminars, and I was actually really blown away at how comprehensive the course was. I did not think that they would have as much insight into it as they would, but I stand corrected. They provided education on disability awareness, different adaptive equipment, the basic adaptive methodology, and how to make adaptive programming. After covering those basics, then they broke things down into different impairment groups. And at the time, they were only instructing on upper extremity, lower extremity, and seated impairments. But over time, they've continued to grow and expand, and they now also have sensory, intellectual disability, and neuromuscular conditions for the impairment groups. So for each group, they went over different safety and training considerations, and then specific exercise adaptations for each impairment. So when it comes to adapting movements for an adaptive athlete, there are many different routes to take. Initially, it just starts by getting to know the athlete, and what their current level of function and range of motion is. And that varies for every athlete. So they offer, 4 different methods to try to adapt these movements. So the first is just by looking at movement patterns. It's typically the most common adaptive method because it tends to be the most intuitive for people. Within this method, you try to maintain similar movement pattern that would be prescribed for the able-bodied athlete. This can be accomplished by just decreasing the load, reducing the reps, or modifying the time or substituting equipment. So for this, I would assume the workout was just jump ropes, which is pretty difficult to do in a wheelchair. So instead, this is a modified equipment. This is called a multi-rope. So it's still, a similar movement pattern, and the seated athlete can get a very intense stimulus. If you ever see one of these and get the opportunity to try it, I'd recommend it. Next is task accomplishment, and this method looks at the real-world functional translation of a movement is. So for a squat, you're just looking to lift your body up from a seated position. For an able-bodied person, this is accomplished from our legs with hip and knee extension. However, for a seated athlete, their real-world translation would be a seated dip. For functional movement themes, this method starts by just looking at what the functional movement theme is within a movement. It's typically midline stability, quarter extremity movements, posterior chain engagement, or active shoulder stability. Once the primary themes are determined, then you try to find a movement that accomplishes the similar theme. If an overhead squat is prescribed for an able-bodied athlete, the primary themes involved are midline stability and maintaining active shoulders. If an adaptive athlete is unable to squat, they could still hold a weight overhead for a prescribed period of time to still train those same themes. And then finally, the final method just returns back to those 10 general physical skills I'd mentioned when describing the CrossFit methodology. For the prescribed movement, you determine the specific stimulus for the workout. If a 5K was prescribed, then the intended stimulus would be cardiovascular endurance. Instead of having a seated athlete roll himself in his chair for a distance, you could have them exercise on a ski erg machine for a specified amount of time to tax the system in the same way. And while I personally think that this is a great option for people with disabilities to engage in physical activity, let's take a broader look at what has been published in the literature. Guinness et al. Performed a systematic configurative review of the participation literature for individuals with a disability. They identified 6 experiential aspects of participation that they called quality participation elements. And these 6 elements are autonomy, or having or perceiving independence, choice, and or control; belongingness, having a sense of being a part of a group and or acceptance by others; challenge, feeling appropriately tested during the experience; engagement, feeling involved and motivated in the activity; mastery, experiencing competence; and then finally meaning, or obtaining a personal or socially valued goal. These 6 elements are actually typically seen throughout most theories of human behavior and are found to be critical aspects in leadership behaviors, group dynamics, and peer mentorship. So another study looked to take Guinness's work a step further to identify specific program conditions that can be used to foster quality participation elements. And they performed a systematic review of qualitative and quantitative research to examine this idea. And the 2 main intervention conditions that they found foster quality improvement were group-based programming and leadership. So for group-based programming, the quality elements of belongingness and mastery were identified. By working in a group environment of peers, coaches, instructors, or even the community the activity takes place in, they were able to establish a feeling of belonging. And then additionally, by exercising with other peers that have had similar disabilities, they were able to see them complete a task which motivated them to aim for a mastery of a movement that they thought may have initially been impossible. And then for the condition of leadership, they found that having instructors knowledgeable in the activity and specific impairments of participants was an important quality for mastery and autonomy because it provided the participants with a feeling of safety. The instructors that were able to help build competence in the individual felt empowered to feel in control and capable of continuing their physical activity independently. These 2 conditions are at the center of every CrossFit class. Every day you're working out within a community that gives you a sense of belonging. And through the efforts of the Adaptive Training Academy, they're helping to educate more instructors to be acutely aware of the needs of individuals with different disabilities. So to round out this section on adaptive training, I just want to quickly highlight this study by Kuhn. They wanted to evaluate the perceived health outcomes from high intensity functional training or CrossFit and motives for initial and continued engagement among current participants with mobility related disabilities. They had 38 participants complete an open-ended online survey and 10 individuals complete a semi-structured telephone interview. The analysis revealed health-related themes including physical, functional, psychological, and psychosocial health outcomes attributed to high-intensity functional training participation. So for physical improvements, participants reported improvement in posture, bowel and bladder function, and improved blood panels like A1C. For functional improvements, they reported decreased reliance on others, independent mobility, and increased engagement in household and community activities. For psychological health outcomes, they reported decreased depression and anxiety, heightened feelings of enjoyment, empowerment, and autonomy. And then for psychosocial health outcomes, they found improvement in general social support and affiliation within their local communities as their gyms were inclusive, accessible, and were able to take part in integrated class settings. Through social media, they were also able to connect with the adaptive CrossFit community to share movement strategies and build camaraderie with people with similar impairments. Overall, it looks to improve the biopsychosocial aspects for all these patients. So finally, I wanted to highlight a quote from a participant that they cite in this article that I found to be pretty powerful. So there's a general feeling in our society that those who are disabled are less than, are broken, and must be protected, that we might break if we exercise. Quite the opposite. High intensity functional training and the community that it provides should be considered imperative rather than dangerous. While our exercise might look different than people without a disability, it is what allows us to be successful in life. It makes us safer, it gives us confidence, it slows the progression of our illness or even stops and turns around deterioration. This took me back to the first quote I shared, where a patient was voicing her frustration with her provider that was recommending she would start exercising, and she wanted to, but she just didn't know where to turn. I hope that after this presentation, if you're ever in a similar situation with a patient, that you feel comfortable giving this as an option to offer your patient. So when I was in med school, a large focus of our curriculum was on preventative medicine. And within the medical world, this is typically seen within well visits with a primary care physician. As physiatrists, we generally don't encounter our patients until they've had some injury or illness that's resulted in a decline in their function. Well, when I was attending the CrossFit Level 1 training seminar, I came across this quote that doctors are like lifeguards, CrossFit trainers are like swim coaches. And when you're drowning, you do not need a swim coach. You needed one, but you did not get one. What you need is a lifeguard. We will teach you how to swim. And when they do not pay attention and they go under, the doctors take care of it. So the patients that we encounter, barring any unforeseen traumatic or unavoidable complications, are the ones that never learn to swim. And I began to think about what preventative care would look like within PM&R and what modifiable risk factors CrossFit trainers could improve to help our patients before our intervention is even needed. And one of the most important factors I think that can help, our field is just pre-morbid function. So when I first saw the sickness, wellness, fitness continuum, I immediately saw it within the light of functional ability. Pre-morbid functional levels is something critical in our patients that we assess when we're looking at discharge planning because we know it's a strong predictor of discharge disposition. Patients with lower levels of pre-morbid functional independence have a higher likelihood of being discharged to a post-acute care facility or requiring home services. Additionally, many older adults have their function rapidly deteriorate while hospitalized, which leads to higher rates of discharge to these post-acute care facilities. Even then, when discharged to one of those facilities, the premorbid functional level tends to predetermine the upper limit of function after rehab. So how do we maximize our patients' premorbid function? It's through high-intensity functional training. It has been shown to not only increase aerobic capacity, but also increase muscle strength, muscular endurance, and power when compared to just high-intensity interval training with like a monostructural element. In a pilot study, cancer survivors completed 5 weeks of high-intensity functional training, and they found significant improvements in balance, carrying a weighted object, lower body strength and power, aerobic capacity, endurance, and flexibility. They didn't have any, rates of injuries, and they also reported high degree of enjoyment within it. Um, there's also another study that has been found to improve function in ADLs, but I'll touch on that study in a little bit. So the next area CrossFit can help us in is combating metabolic syndrome. It's a group of conditions or risk factors that when combined raise your risk of coronary artery disease, diabetes, and stroke. The 5 risk factors are abdominal obesity, hypertension, elevated blood glucose, elevated triglycerides, and low HDL. And it's been estimated that about a third of the adult US population has metabolic syndrome, and it's becoming more prevalent in the pediatric population. As these numbers continue to rise, so will the risk of strokes. Currently, strokes make up about 20% of admissions to acute rehab hospitals. This is both nationally, you can see within the top chart or within the top graph, and then on the bottom, this shows our local admission rate. So as physiatrists, we're all well aware of how debilitating these results can be and the toll it takes on the individual, family, and community. So how can we combat metabolic syndrome? Well, the predominant underlying risk factors have been found to be abdominal obesity and insulin resistance. So Feely et al., actually out of Cleveland Clinic, they conducted a study with 13 middle-aged adults with non-insulin dependent type 2 diabetes, and they had them perform high-intensity functional training 3 times a week for 6 weeks. They found significant improvements in insulin sensitivity, diastolic blood pressure, and serum triglycerides, as well as non-significant improvements in systolic blood pressure and waist circumference. Additionally, they saw significant reductions in body fat, and altogether, they did have a significant reduction in their metabolic syndrome Z-score. And then another study examined the weekly frequency of high-intensity functional training and its impact on cardiometabolic markers in people with metabolic syndrome. They recruited 21 people and randomized them into 3 groups, and they'd have them perform CrossFit training once a week, twice a week, or 3 times a week for 12 weeks. And then they looked at various cardiometabolic markers. All 3 of the groups showed improvement in their metrics, and most importantly, they found that even one high-intensity functional training session per week had better improvements in the metabolic syndrome severity scale than just metformin. Additionally, they all reported high exercise enjoyment and likeliness to continue, which is an issue that we'll talk about as well. So the final factor that I believe can be improved through CrossFit is by helping our aging population age with grace. There are currently around 60 million Americans aged 65 and older, and this is projected to increase to 82 million by 2050. The vast majority of our patient population fits within this range, and we see many of them from complications related to frailty and osteoporosis. Across the globe, every 3 seconds, we see patients with poor bone mineral density suffer a fall resulting in a fracture. While there are medications to increase bone mineral density, the research is pretty clear that exercises incorporating strength training and plyometrics not only increase bone mineral density, but also help reduce the risk of falls. The American College of Sports Medicine notes that adults that participate in the resistance training have higher bone mineral density than adults engaged in normal physical activity like walking or cycling. Now, I didn't find any studies that examined bone mineral density changes from CrossFit in the aging population, but there was a study that assessed bone mineral density changes in the general population, and they did find increases after just 16 weeks of training. Now, frailty is an additional issue in this population. The frailty phenotype contains 5 criteria: unintentional weight loss, self-reported exhaustion, slow walking speed, weakness, and low physical activity. And frailty is diagnosed in an adult if 3 or more criteria are present, or they're called moderately frail if 1 or 2 criteria are present. So a study out of Columbia looked at the effects of 12 weeks of high-intensity functional training on functional capacity, frailty, and the physical condition of older adults with mild cognitive impairment. It was a randomized controlled trial that compared high-intensity functional training to a control group receiving just general recommendations on the benefits of physical exercise, similar to a lot of our patient encounters. At the end of the study, they found high intensity functional training to have significantly improvements in lower body strength in the chair to stand test, the upper and lower body flexibility, 6-minute walk test, balance, and risk of falls. There was a non-significant improvement in the frailty score. Additionally, they found improvement in functional scores from moderate dependence to independent. And when comparing IDLs, the majority of the participants were in the mild dependence category. However, the control group had a significant change with 25% of the participants advancing to moderate dependence just over these few weeks, while the high intensity functional training group had all participants remain in the mild dependence category. Overall, I think high intensity functional training is a strong tool that can be used to help our aging population. So it comes as no surprise to us that exercise and physical activity is paramount to living a healthy lifestyle. The ACSM recommends 150 minutes of moderate intensity aerobic exercise per week, or 20 minutes of high intensity aerobic exercise 3 times a week, in addition to strength training on at least 2 days a week. However, roughly 75% of the US adult population does not meet this minimum recommendation, and about 36% report no physical activity at all. It's no wonder that the rate of inactivity combined with highly processed foods and diets high in sugar that we're faced with such difficulties in combating metabolic syndrome. And one of the biggest challenges is getting people to start working out and sticking with it. So what happens after we tell one of our patients that they should start exercising? Hopefully they go home and at least they think about it, right? They try to find some motivation, but feel like they have limited time. They finally plan some time in their schedule to hit up a nearby gym, but immediately they feel overwhelmed when they see the overcrowded space, all the different machines. They don't know where to go. And they realize what limited knowledge they have of exercises, and then they have no idea where to begin. So maybe they go and they hop on a treadmill or elliptical for 30 minutes. Inevitably, with all of this uncertainty comes a fear of judgment and the feeling like everyone is watching them. This can lead to a sense of isolation, especially when everyone has headphones in or they're just watching TV while they're on the treadmill. After a few weeks, they get tired of going to the gym, they aren't seeing many results, and they haven't connected with anyone. Their life continues to stay busy, and without seeing any results of their efforts, they get discouraged and they fall back into the cycle of a lifestyle of inactivity. However, within a CrossFit gym, you see a completely different setup, which has been attributed to higher rates of enjoyment and adherence, which can be linked to several key factors. Firstly, the inclusive nature of CrossFit gyms caters to individuals of all ability levels. The set class schedule encourages participants to plan their workouts in advance, um, fostering commitment. Upon entering the gym, a warm welcome from the coach and socializing with the classmates creates a sense of community and establishes a supportive environment. The coach's thorough explanation of the daily workout, including the intended stimulus, proper form, and scaling options, ensures that participants feel well prepared and confident. The communal atmosphere motivates individuals to push their limits and grow, and as they work together to master new movements, achieve personal records, and look to improve their health outside of the gym. Constant variation in workouts prevents boredom, and instead, participants find themselves engaged in overcoming challenges, building confidence, and enjoying the journey towards better fitness and independence through life. So, in summary, CrossFit is a strength and conditioning program that utilizes constantly varied functional movements performed at high intensity. They work to build a broad level of fitness to create a level of super wellness that protects against time and illness. It's a program that's designed for all skill levels and all ability levels, trying to maximize a lifetime of function and independence. When following the principles of mechanics, consistency, and then intensity, you're able to stay safe and reduce the risk of injury. While improving your fitness, you're also able to have fun working out and become part of a supportive community that encourages you in the gym and other areas of your life. So thanks for listening to the presentation. I hope it was entertaining and informative. And if you do decide to start CrossFit, who knows where it could lead you? You might end up like these four. And then finally, I'd just like to thank my wife and son for being patient and supportive while I've been working on this presentation. And I'd also like to thank everyone within the CrossFit community that's helped me grow over the years and inspired this presentation. I'll open it up to any questions. Dr.
That was
Holman?
fantastic. A quick question.
Yeah.
Um, how do you find local places? Now I'm tempted to join something and injure myself so I can take time off. But
Yeah.
what
Try to
as I
get it.
go
Yeah,
ahead.
try to get it covered by a company outing, so then you can claim it for workers' comp first. Um, but no, so you can, I mean, easily you can just Google it. But also if you go to CrossFit's website, you can find a gym, and you just, type in your area code or area, and they can pull up all the local gyms for you. Dr. Holman?
You probably know what I'm going to ask, right?
I'm not sure what.
Well, we get lots of adolescents, able-bodied and not, who are looking to join this community.
Mhm.
And I'm interested in what Geraldine has to say as well. Obviously, we wouldn't recommend it for younger people or anybody under 12. And the things we worry about are growth plate non-closures and avulsion fractures, in addition to the sort of usual stuff that we get. But did you run across in your reading anything about adolescents?
So I didn't specifically look into that for this, but I know that the literature has shown that strength training in pediatric and adolescent population is safe. They have not seen long-term side effects from it, or impaired growth, things like that. I know it was a major concern, but a lot of studies more recently have shown that. I can. There's one researcher that did a lot of work in this. I'm blanking on his name, but I can look up an article and get it sent over to you.
We have this huge cohort of young men who have now complete spinal cord injuries, and I think they would be interested in something like this, if I could assure them that it was safe, and if they had somewhere to go that they didn't feel out of place in their wheelchairs.
Yeah, yeah. And so that was one thing, looking at the different aspects of, trying to get this started within a community. Like if you are trying to get involved, there was a lot of discrepancy between, the adaptive athletes wanting to be in just an adaptive CrossFit class versus being part of the community. It was really conflicting. So I know it's a CrossFit gym in Chagrin Falls. I believe they're adaptive. So they have, you can intersperse within their class, but they also have a specific adaptive CrossFit class that I think they're getting started up on. I think it's called like CrossFit First or something like that. But I know they have an Instagram page, and it's on their website. But I believe it's CrossFit First.
Cool. Thanks.
That's the only one that I know of within the area right now, but I might be wrong on that.
Ben, very motivational. Is there a
Thanks.
friends and family discount that you could provide us with?
If you join with family members, you do get a discounted rate. But
Okay.
I don't get any like signing bonus or anything like that from it. So I wish.
Well, on a more serious note, I would find it very intimidating walking into a CrossFit gym, even just as an able-bodied person. So
hmm
how is the intake or the evaluation conducted? Is it similar to when you go to, I don't know, LA Fitness or the YMCA? Is there someone that evaluates you and shows you certain machine or equipment that you could use? I just understand that you talked about barriers. One of the
hmm
barriers is the overwhelming sheer volume of the equipment. And yeah, is there an introductory course? And
Yeah.
if you are not able-bodied, yeah, do they assess you first to see what your level is?
Yeah. So before you get started and join, like the full group fitness classes, vast majority of the gyms have you do an onboarding program. This could be in a group setting. So whenever I first started, I started with like 5 other people. So they would typically start you with, kind of all the newbies. For this gym, it was like on the first of the month that you would start, and you would meet for a couple of weeks. You'd go over a lot of the, primary basic movements, and also, just a lot of the like foundational functional themes like posterior chain engagement, things like that. Making sure that you understand those basic movements. Then once you have, some baseline competency in that, where you're, getting very much almost one-on-one level training, then they move you up towards the group class. And even then, whenever you're in there, the coach keeps, especially a keen eye on the new participants, and you are all like, you should be scaling the workouts very, very much so at the beginning, because it's, they can seem very simple, like just the Cindy workout that I showed. It's just pull-ups, push-ups, air squats, no problem. Like, you don't think like, yeah, I can do that. But if you try that, day one for the full 20 minutes, you'll burn yourself out and not be walking for a week. So you do really need to start off at a very scaled approach and ease into it. Yeah. Logan, you got a question?
You did mention that CrossFit's a cult, which I think that would probably help with adherence, though. So I was wondering, in your research, though, did you come across anything that talked about how long people stick with CrossFit in terms of physical activity, and if it compares with other types of physical activity, if CrossFit does better or worse, or even like, anecdotally, if you've seen anything at your own gym?
Yeah. So first and foremost, if you are at a CrossFit gym and you start seeing them drinking Kool-Aid, immediate red flag. It's way too much sugar. It's not Kool-Aid. CrossFitters would not drink it. So don't drink the Kool-Aid if you're there. The research does show that, there's higher rates of adherence and enjoyment within it. A lot of it is because of the community aspect. You end up, making friends with people that you're working out with. So it does lead to higher rates of adherence to it. I don't think they looked at like specific numbers of like how long someone, or if they do, I didn't read it or pay as close attention to it. But they did show that, it leads to higher adherence rates for it. A lot of it's really fun. Like, in high school, if you were working out within a team and things like that, you're in the weight room, everybody's working out together and you're socializing through it. And then you also have music playing. So everybody's listening to the same music. You have, a great atmosphere built up around you, as opposed to, you just having headphones on. You might be listening to a great playlist and getting psyched out. But it's not shared across, the entire community. Whereas, that's something that you do have within CrossFit. And then additionally, sometimes the workout is just what you're doing individually within the group, but there's a lot of partner workouts as well. So you might be splitting reps or rounds or things like that. So you get to work even more one-on-one with each other.
Yeah, I think the social aspect is nice for adherence. Just make sure you don't go to the retreat in South America.
Exactly.
So I will have to ask this question. Again, barriers. What is a typical cost
Yeah.
for
So
members? Is this a membership? Is this
yeah.
monthly, quarterly,
Yeah.
annually?
Yeah. So, everybody has kind of different payment structures for it. Some might give you discounts if you do like a 6-month membership or a 1-year membership, but cost is a barrier. I think it's usually, I would say, averaging out around $150 a month. So it is, more significant than say $70 to, the Y or JCC or something like that. I'll say though, and this is what brought me into it. I was initially, so during my second year of med school, I was working out at, oh gosh, what is it? Lifetime Fitness. And at the time, my school was paying for it, so I didn't care. But then the school said that, after second year, they weren't going to be paying for it anymore. And I really wanted to learn Olympic lifts because I thought that they were fun. It'd be something new, challenging to do, but I didn't really know how to do them. So I was practicing one time and one of their trainers came up and was starting to give me some advice. It was really helpful. And then after she's like, yeah, if you want any more training, it's $60 a session for an hour. And I was like, it's pretty steep. That's like the price of a monthly membership for this. So then I started looking into different avenues, looking at different gyms, and most of them were around like $70 a month. And Planet Fitness is like $10 a month. So, but I can go on a whole tangent about Planet Fitness. But so for joining CrossFit, you're able to essentially get, you start off with one-on-one training with essentially personal training. And then once you go into the classes, you have the programming set. That's, I enjoyed programming. I had almost like a minor in exercise science in undergrad. I just didn't finish a couple of the courses because I just didn't have the time. I was focused on other things, but so I knew a good amount of programming and how to put things together, but it was just getting, tired and taxing. So I figured go and do CrossFit. They'll set up the programming. They teach me how to do a movement if I don't know how to do it. And then additionally, as I'm doing it, if I'm doing things wrong, they can catch me, point it out to me, give me different cues that I may not have thought of before. So you do essentially get a level of personal training at a fraction of the cost. But again, it is more expensive than a typical gym that you would go to, but I think it's worth it.
Susan, Linda, are you still on? Would you happen to know, if you are there any high intensity studies going on through the NI or any other department? Sorry, I didn't mean to put Dr. Linder on the spot. Oh, I can ask her on another day. But any other comments?
Does Colby go with you?
Sometimes, yeah. Yeah, he's a lot of fun. Yeah. I'll end up substituting him sometimes instead of a wall ball. I'll use Colby. But he's like an extra 15 pounds more than the wall ball, so it gets pretty intense sometimes.
That's awesome.
But he loves it. And honestly, that's another thing with children, seeing their parents active. That's something that also encourages, exercise and physical activity within adolescence, or within kids as well.
So we can take babies with us?
Sometimes it depends on the gym. But yeah, I mean, so one of our trainers, Kyle, his son is a little bit younger than Colby, and he brings him a lot. That was, if you saw in the video, the kid rowing, that's Miles.
Yeah.
So Colby and Miles will, hang from the bars and try to do ring rows and things like that. It's pretty cute. They'll walk back and forth and chalk their hands up from the chalk bucket and then jump on the rings, and just hang around. So
That's awesome.
it's a fun time. Yeah.
Hi, sorry, this is Susan. I had to take my dog out really quick, but I had my son listening in, who also goes to CrossFit Distinction.
Hey, Joe.
And he said that I was called on. I'm like, you have to get on if I get called on. So, sorry, what was the question?
Are there any high intensity interval training studies going on at the NI or even at ortho that you're aware of?
I don't, within the NI, so we don't have studies going on in high intensity interval training, but there definitely are some in the primarily stroke community. And the big approach that's been started is high intensity gait training. And they do use an interval training approach. They monitor heart rate. Sorry, my thing is really bright. And it's still targeted at that 60 to 80% range, so it's not quite the anaerobic range that is achieved through this the more high intensity functional training that CrossFit does. But again, it's still interval, usually treadmill based, and they're seeing really good evidence with improved function, improved cardiometabolic function. So yeah, I think there's no one size fits all approach. And I think that's the important thing is people tend to jump on bandwagons, of, oh, I'm going to do just this or just that. I think a cross training approach is really important for the disabled community so that we address all of their needs.
Oh, great. Yeah, it would be wonderful to see how this could be implemented and even starting off stroke patient population, Parkinson's, what have you. Any of our neurologic conditions, but yeah, that would be to be determined. What I propose for our residency program is that our annual retreat be at one of these CrossFit gyms, so we can talk about that after hours. Well, thank you everyone for joining in. Again, this was a very motivating talk. Thank you, Dr. Burnham. And we will see everyone at the next grand rounds next month. Have a good evening.
Take care. Thanks, everybody.